everyone. Thank you for waiting patiently. I see several of our community partners on and staff and faculty. What a great group. I'm Ellen Hahn. I'm the director of the UK CARES Center for Appalachian Research and Environmental Sciences, and just welcome you here today. If you're not a member, remember you can go to our website and become one. We have full associate and community members. I also want to tell you that we do have our research services portal up and going, so you can click on a survey and tell us what you need, and we can try to connect you with what you need in environmental health science. And lastly, the drum roll is that we finally have our community health environmental assessment reports up on the website, and they're ready for you to read. And I know that researchers on the group have been asking often, we want to know what the community needs so we can plan our research. So it's up there. So Kara will be sure to put the link in the chat. And without further ado, I want to introduce my colleague, Dr. Erin Haynes, who's the Deputy Director, and she will introduce Christina, Dr. Fuller. Thank you.
Awesome. Thank you. And welcome again to everyone. We are truly in for a treat today. Dr. Christina Fuller joins us today. She has expertise in community engagement, environmental health research. She looks at fate and transport of air pollution. She looks at disproportionate environmental burdens on marginalized populations. She leads a study in Atlanta looking at the ability for near roadway vegetative barriers as a mitigation for particulate matter. Her work's been funded by NIH, the CDC, and the JPB Foundation. She also just had a book accepted. She's a co-editor of a book called Ambient Combustion, Ultrafine Particles and Health, which is super exciting to be a co-author or an editor of a book. And she's a member of the EPA Clean Air Scientific Advisory Committee. And I just had the privilege of working closely with Christina on planning. She was a member of the technical organizing committee of the International Society for Exposure Science, where she organized affinity groups, took the leadership initiative, organized affinity groups for the entire society, and they were just so well received and a great value added. So she is I want to say she's an up and coming environmental health scientist, but she's already there. So welcome, Dr. Fuller. We are absolutely thrilled to have you. Thank you so much for joining us today.
Thank you so much. It's really a pleasure to be here and here. I really enjoy that people I see some hand claps and some thumbs up. So, I really enjoy that function of Zoom. It makes it, a little bit more interactive. I have several pieces of my research and experience I'm going to discuss today. And then we're going to have a little bit of an extended Q&A so that we can talk about whatever resonates with you, your experiences. So I'm really looking forward to the Q&A portion as well. So next, I'm going to share my screen. And then, so I shared that, and then everyone should be able to see. Okay, excellent. So, again, thank you so much for the opportunity to speak with you all today. And I've been working in the field of environmental health for over 15 years. And before that, I worked as an environment engineer and provided technical assistance to nonprofits conducting environmental health advocacy. So air pollution has been the focus of my research for much of that time. And today I'm going to present research on air pollution and health interactions, as well as explain how that research was enriched through community engagement and environmental justice principles. Okay, let me click on the right place. Excellent. So many times I start my talks with this figure, this table, which talks about the basic human needs of food, water, and air. So I want each of you to think about each of these and which do you think is really most necessary for life? And then I'm going to remove this little box here. And some people may not realize it, but we really require the most of these three of air, approximately 50 pounds a day, on average. And we can only go without that for 5 minutes. So the quality of the air is really important just for us to be living and to be living well. And there's hundreds, if not thousands, of pollutants that are present in the air. And the United States has standards for a whopping 6 of them: particulate matter, ozone, nitrogen dioxide, sulfur dioxide, lead, and carbon monoxide. And out of those, I focus my research on particulate matter because it's associated with an abundance of health effects in numerous body systems, such as respiratory, cardiovascular, reproductive, etc. And I focus on the smallest fraction of these particles, which are ultrafine particles, as you can see by the red arrow there. And those are particles that are less than 0.1 microns in diameter, and they cannot be seen, they cannot be smelled, and they're many times, seem to be invisible, although they can affect your health. So sources of ultrafine particles include many industrial processes, fuel combustion from oil, natural gas, coal, and also wildfires, which has been in the minds of many of us in the country recently. And levels of UFP in a very clean lab are about 2,000 particles per centimeter cubed. And levels next to a diesel truck, which is about to take off, can be upwards of 300,000 particles per centimeter cubed. So a very wide range of exposures are possible. So again, a lot of my work focuses on health effects of particulate matter on the cardiovascular system. And this figure shows the cascade of responses that connect particulate matter to cardiovascular effects. In the next few slides, I will focus on 2 of these cardiovascular biomarkers, which evaluate 2 possible mechanisms of effect. And the first is C-reactive protein, here, CRP, which is related to the inflammatory pathway this way. And the second pathway is through the autonomic nervous system, and that's related to changes in blood pressure indicated here. So the study is within the Boston, Puerto Rican Health Study. And this is a project created by a group of researchers and community partners that came together as part of the Boston, Puerto Rican Center for Population Health and Health Disparities. And the focus of this research project was to examine the role of stress on physical disability, cognitive decline, and metabolic conditions. And the project was broadened to evaluate air pollution as an important environmental risk factor for disease. One of the first aims was to test the association between particulate matter and cardiovascular disease markers in the Boston, Puerto Rican Health Study. And the second aim was to evaluate effect modification by psychosocial stressors. So stress may result in wear and tear on the body, resulting in more severe responses to particulate matter insults. And that's why we wanted to explore that. And there are many dimensions to psychosocial stress. In addition, there are various evaluation tools or instruments to measure each one. So we evaluated several and found that the most robust results were for the Perceived Stress Scale, or PSS, and the Center for Epidemiologic Studies Depression Scale, a measure of depression, or the CESD. So health disparities exist for many exposures and diseases in the United States. And I am interested in identifying susceptible populations because we want to reduce exposures and improve outcomes for the most sensitive and highly impacted groups. And self-reported health is one indicator where we can see disparities both between and among groups. And so again, we're looking at Puerto Ricans. So Hispanics are now the largest minority population in the United States, but it is not a monolithic group. And next to Mexican Americans, Puerto Ricans are the second largest subgroup of Hispanics. And as seen in this chart of data from the National Health Interview Survey, Puerto Ricans self-report fair or poor health more than other Hispanic groups. In addition, Puerto Ricans have the highest incidence among other Hispanic groups of physical disability, type 2 diabetes, and depression compared to other groups. And it's very important to understand the health disparities among and between the Hispanic population. So this table shows baseline 2-year and 5-year data. This is repeated measures because this is a longitudinal cohort over 5 years. And here we have under cardiovascular health markers, systolic blood pressure and C-reactive protein. And as you recall, normal blood pressures are below 119, those deemed as normal. Kind of mildly pre-hypertensive are 120 to 139. And then hypertensive is those over 140. And as you can see for this cohort, it's in the pre-hypertensive range, just on average among all of the people in the cohort. And it also shows a high risk for cardiovascular disease, because when you look at the C-reactive protein levels, less than 1 is a low CV risk, average is 1 to 3, and high is greater than 3. And the mean is high for the cohort overall. Also looking at the paper-based stress measures, depression score and perceived stress are also higher than if you were to look at the whole entire general population of the United States. So here are some of the findings. We were interested in looking at short to medium term exposures. So this is just looking at a change in ultrafine particles and then the response in C-reactive protein. We explored 6 exposure periods, beginning with a lag of 0. So that's the current day measurements of ultrafine particles, and then health measurements that were measured that day. Then we looked at the previous day, lag 1, and the previous 3 days, or lag 3. We also looked at moving averages of 3 days, 7 days, and 28 days. And the mean daily average particles was 24,000 particles per centimeter cubed, and the IQR for this cohort, or the interquartile range, was approximately 12,000 particles per centimeter. We created multivariate mixed effects models for CRP. We included age and sex and other significant predictors of the outcome. And we found that for every interquartile range increase in ultrafine particles, there was a statistically significant increase in CRP of about 9%. And that was pretty much stable, as you can see here from the figure. So again, we looked at systolic blood pressure. And for those models, we found for every IQR increase in UFP, systolic blood pressure was an increase in about 1.5 millimeters of mercury. That's where you see on average, looking at these different lags and different moving averages. Small, but statistically significant at all time periods. And then within that, what I was really interested in looking was if there was a difference by our 2 measures of stress, perceived stress scale and depression scale. So we examined those differences for those of high and low stress and depression at the exposure lag period of 0. And we dichotomized low from high on this side by the, there you go, by the 90th percentile, and above was high and the rest were low. And then we also looked at quartiles of exposure over here. So as you can see for C-reactive protein up here on the top, that the effects were higher in those that were more stressed or those that had greater depression symptoms, although these differences were not statistically significant. Looking at the systolic blood pressure, we see very similar, that there were some differences with looking at the quartiles, but again, not statistically significant. So there may be a lack of significance due to our sample size. The cohort was a cohort of 1,500 people, and then repeated measures for those of up to 3 repeated measures. And also it's possible that the body may have been overwhelmed by the stress measures, which may swamp the impact of the air pollution. And we can talk about that further during the Q&A period. So overall, from these analyses, we found that increases in UFP were associated with higher levels of cardiovascular markers, C-reactive protein and systolic blood pressure. And the effects were pretty stable across exposure periods, contrary to some past studies where they found an increase in the effect with longer averaging times. There are some sources of variation, and they remain in this population based on indicators of perceived stress and depression. But again, those were not statistically significant. And so this points to some further examination, and that can yield insight into susceptibilities, and as well as opportunities for intervention to reduce the impact of air pollution exposures on cardiovascular markers. So let's change gears just a little bit and discuss how it's important to understand that air pollution is not equally distributed across the globe or even within populations and within cities. So this map from the World Health Organization shows the annual average PM2.5. So those are particulate matter less than 2.5 microns in diameter, and how that varies between countries across the globe. So what's indicated here is that the darker colors are higher concentrations of PM2.5. And what is evident is that worldwide PM2.5 levels are higher for developing countries, and especially in East and Southeast Asia, the Middle East, and Africa. And a recent estimate of the burden of disease from ambient air pollution is evidence for these air pollution health effects as well. The estimate was that 4.2 million excess deaths worldwide and 103.1 million disability adjusted life years were dailies. And again, sources for PM2.5 include power generation, especially coal and natural gas, traffic-related air pollution from gasoline and diesel burning, many types of manufacturing processes, as well as wind-blown dust and sand. So not only do we have those differences between countries, but we also have differences within cities. And this is the focus of most of my research. There's a great deal of variation on the local scale, even looking at a pollutant like PM2.5, which varies at a smaller smaller level than ultrafine particles, which vary even more across short distances. So the map here shows the downtown area of Atlanta, where Georgia State University is located. And you can see how the PM2 concentrations vary on a smaller scale. The red is for higher concentrations, and the green is for lower concentrations. And the driving force behind this air pollution variation within the city is traffic exhaust, home heating, and other local sources. So there are reasons for this, some that have been studied to a more extent and some to a lesser extent. So there's a great deal of research on the physical determinants of air pollution concentrations as they pertain to the position of sources within the built environment, emission levels, and also meteorology, including temperature, wind speed, and wind direction. However, in addition to that are those upstream conditions that control where sources are located, what they release, and who lives close by. So industry tends to cluster together in specific locales due to the price of land, zoning practices, and this can put certain populations at a disadvantage. There are also specific practices such as redlining that have adversely impacted Black and other communities of color, putting them at a greater proximity to sources. Historically, poor and minority communities are closer to roadways And even the federal highway system was laid out in a manner that deliberately ran through viable and economically stable Black communities. So these associations are often persistent, but they can also be dynamic and can change quickly, particularly in urban areas as demographic profiles change. And although this talk is focused on air pollution exposure and social demographic factors in the United States, this also occurs across the world as well in other urban settings. So in response to the systemic disadvantage heaped upon some communities, there has been resistance. And communities have organized against the unfair targeting of their communities as dumping grounds. In the early 1980s, the poor and majority Black county of Warren County, North Carolina, was selected for a hazardous waste landfill. And the protests by residents and supporters brought environmental justice onto the national stage. The multi-year activism in Warren County and other communities increased interest in evaluating waste sites across the country. And one of the first seminal works examining environmental injustice was the Toxic Waste and Race in the United States. This report was written in 1997 by the United Church of Christ and examined the link between hazardous waste sites, both for storage and for disposal, and race. And it specifically evaluated burdens on African Americans, Native Americans, Pacific Islanders, Asian Americans, and Hispanics. And what the assessment found was that race was the most significant variable associated with the location of commercial hazardous waste facilities. And this meant that 3 of 5 landfills were in majority Black or Hispanic communities, that 3 of every 5 Blacks and Hispanic Americans lived in communities with uncontrolled hazardous waste sites, that half of Asian and Pacific Islanders and Native Americans lived in communities with uncontrolled sites, and that socioeconomic status, while it was very important, race had a stronger effect on the location of these facilities. The study was repeated after 20 years in 2007, and they found that very little has changed. And recent estimates from different researchers have found that this still hasn't changed too much, even with the progress that has been made with environmental justice over these many years. So to talk more about the environmental justice movement, we begin by saying that the traditional environmental movement began with a focus on conservation of native flora and fauna, and it is more top-down with large organizations and the government setting the agenda. The environmental justice movement is a grassroots movement which is broad and more loosely organized. That is to say that it relies on a bottoms-up approach. A dedication to preserving natural landscapes, plants, and animals are there, and also our place within that fabric. However, so is creating healthy food sources, educating young people about sustainability, building healthier cities, public health and health effects, and maintaining indigenous cultural practices are all integral to establishing and maintaining environmental justice and are key for the environmental justice movement. The EJ movement has roots in the United States, but inequity is not an American phenomenon, so environmental justice struggles and successes occur all over the globe. So environmental justice has a purpose. It's not just a movement just for awareness. Its focus is to have systemic change. So part of that process is to first identify where there are inequalities. And I like this figure because it gives a good representation that we can identify with equality being there on the left-hand side. But not to stop just at identifying inequalities, but also to move towards equity, which is the provision of resources and support according to need. And better yet, is to break down the barriers and establish true justice and new alternatives. Instead of simply removing where hazardous waste sites are located to make them more equitably spaced, why not remove hazardous materials from products? Instead of putting barriers to reduce air pollution near roads, perhaps we can have more transit and electric cars to reduce the source of pollution from our traffic systems. In 1991, the environmental justice activists of the time joined together for the first National People of Color Environmental Leadership Summit in Washington, D.C. And not only were many racial and ethnic groups from the United States in attendance, but also from other nations across the world. They established 17 principles of environmental justice, and 3 of which I'm highlighting here because they relate to community engagement. So principle number 5 is that environmental justice affirms the fundamental right to political, economic, cultural, and environmental self-determination of all peoples. Number 7, environmental justice demands the right to participate as equal partners at every level of decision-making, including needs assessment, planning, implementation, enforcement, evaluation, and I would add to that research. And principle number 16, where environmental justice calls for the education of present and future generations, which emphasizes social and environmental issues based on our experience and an appreciation of diverse cultural perspectives. So increasing community engagement in research embodies these environmental justice principles. So community engagement and community-based participatory research, or CBPR, have become much more common, I'd say, in the past couple of years. And it's important to really understand what's meant by different types of engagement. And engagement is not a specific formula, but instead it's a continuum, and partners can take a multitude of shapes as outlined in this figure, which I like. So for example, on the left-hand side, you have outreach, my pointer. And this is where researchers may conduct a study about air pollution and asthma, and then share findings with community members. And it can go through various levels of engagements and more intense engagements to the right-hand side, where you have community-based participatory research. And this means that communities can lead research priorities, data collection and interpretation in partnership with academics and practitioners, and also relies on shared leadership between communities and academics. And this makes knowledge and data much more sustainable. So now I'll get into my personal experience with a particular project, now an umbrella for many projects, called the Community Assessment of Freeway Exposure and Health. So the project and results looking at socio-environmental interactions at the start of this presentation is related to this project here, the CAFE study. And this was a relationship between academic and community partners, which began in 2005 and had the first grant funded in 2008 called CAFE. And that was a 5-year cross-sectional study of ultrafine particles, UFP, near a highway and markers of inflammation and blood pressure, those cardiovascular disease indicators. And it involved several neighborhoods in the Boston area. And it started off with a smaller number of just a few of these community partners and institutions, but has since expanded to include more universities and more community partners. And if you want to take a look, they have really great information and outcomes, fact sheets on the website here that I have listed at the bottom. So my role when I first began working with CAFE was as a student member of the Community Advisory Board. And since I graduated many years ago, I have become a collaborator on subsequent projects and did my dissertation research on this as well. So a key part was the monitoring and sampling of air pollution, which again has expanded over the years. So stationary monitoring that you can see kind of from this site down here on top of a rooftop next to a highway, also including mobile sampling, as you can see here. This is an RV that was stripped on the inside and included a lot of different instruments to measure particle concentration and size, particulate mass, black carbon, nitrogen dioxide, other air pollutants, along with meteorology as well. And also residential monitoring, which I was a part of, with these mobile boxes that were placed in different homes, measuring indoor and outdoor concentrations of ultrafine particles. And here are some of the homes here that were in that study that I was involved in. And it generated a good amount of pollution data that was utilized. Right here, this is an example of data collected showing concentrations of ultrafine particles on this particular route in Somerville. The darker concentrations are, the darker colors of red were higher concentrations, and the lighter colors of yellow were lower concentrations. So from this, we had lots of detailed air pollution maps, and those were used for exposure analysis and also health outcomes assessment. This type of research not only created data that was used by the researchers, but also tools that could be used by community members so that they can understand and map where concentration of pollution were highest and lower in their communities close to where they lived, where they went to school, where they were commuting through. And this is an example of an interactive map of Chinatown traffic pollution, where it had, and this was available, and still is available online, and it shows the concentrations here on the right-hand side. And it has landmarks that could be overlaid where different businesses were and where different universities were, and people could actually find their own locations and have that real time information for themselves, so that if they needed to feel like they needed to tailor when they went out to do their walking or their shopping, so that they could do that and utilize it for amenities in their communities as well, and getting changes to be made, which leads into the next slide. So in addition to just identifying where the risks were, part of this project and subsequent projects were to identify ways that the community can advocate for itself and how planning can occur and make real changes in the community by working with the local government. And so this shows different mitigation measurements and policy changes that were made possible from different design charrettes with multiple stakeholders. And this is in looking at architects, agencies, community members, planners, integrating them all to actually find some viable solutions to the high concentrations that were detected. So they evaluated active filtration as a method to reduce the movement of pollution from the outdoor into the indoor environments. This is for people who live near highways. Also, changes to the built environment, such as establishing buffers between traffic corridors and populations. Some of those could include sound barriers, sound walls, and even green infrastructure. In addition to looking at associations between exposures and outcomes, the data was available to look at time average concentrations based on people's time activity, of what your levels are like if you stay in your house all day or as you move from place to place. So those are more relevant for people because we don't just sit, even though we have been doing this a lot in the recent years, but we don't spend all of our time just at our house, which is many times where exposures are estimated from, but we do move about in different microenvironments. So this shows how there's an estimation of health impacts and associations for particular communities, really making associations for incidents of blood pressure, hypertensive blood pressure, for coronary heart disease incidents, ischemic stroke, type 2 diabetes incidents, lung cancer, and even childhood asthma, based on the associations that were identified. So again, a range has come out of these community-based studies. The first study was funded here in 2008, and this shows how the expanding group of stakeholders were able to obtain different grants in the future to look at different aspects, to figure out how to put together new plans to ameliorate the issues that were identified. And over 11 grant proposals were funded from the CAFE umbrella of studies, and approximately 60 journal articles on UFP monitoring and modeling, exposure assessment, environmental justice, and health outcomes. And as Dr. Haynes had mentioned earlier, a book on ambient ultrafine particles and health, co-edited by myself and Doug Brugge, who was the first to apply for that very first grant from NIHS back in 2008, and is still very involved with the project. So I have continued my engagement with communities, moving from Boston, where I went to graduate school, down here to Atlanta. And this is a project funded by the NIHS of looking at tree barriers as a way to mitigate air pollution concentrations coming off the road into local environments. And this began as really a community group coming to me with some pilot funding of looking at this very same question and identifying what the concentrations were outside of a school that had an outdoor classroom. So a really relevant issue of, we want our kids to be outside, but if that outside space is near a road, what are the concentrations? And if having trees there could reduce those concentrations and make it a healthy indoor environment, outdoor environment for the children to be learning in. And so these are some just preliminary data from the most recent study, which looks at multiple sites in the Atlanta area. And we've been finding that there have been reductions in ultrafine particle concentrations, comparing sites that have tree barriers to sites that do not. And even though this project and others are ongoing, there is a set of guidelines from the US EPA, who has been at the forefront for some of this research, about some guidelines and best practices about establishing trees as barriers next to roads in different locations. So there are benefits to community engagement for both communities and for researchers. And I have some here. I think that it helps to demystify science for the community and enhance people's understanding of the scientific process and its methods. It can increase scientific literacy, and people will appreciate science when it is for and with the people. And it helps to empower the communities to take action, to conduct their own research, or to contact people within their community and governance structure about what some of the environmental threats are to their particular communities, and to have some data to back up some of the questions that they have. And also for researchers, community involvement can lead to more relevant research questions. Like I said, looking at tree barriers in reference to outdoor classrooms or outdoor sports areas as well. More certainty with regards to exposures and outcomes, because really knowing what the population is exposed to with how they move about in their communities, what types of jobs they have, what other type of stressors they may be exposed to, and to develop more readily adapted solutions to local conditions that can be put into place and sustained over time. However, there are challenges to community engaged research, what I'm expecting people in this center are familiar with. It takes a lot of time to establish partnerships with community members. It's not something that's done overnight, and that needs to really take place ahead of time before applying for grants and other funding. Also, balancing research and community priorities many times can be a trade-off or something that really needs to be meshed together and be made complementary. Because in addition to looking at an environmental health exposure or outcome, there may be other issues such as mental health issues or safety issues that also need to be addressed and taken into context with the environmental hazards. Setting long-term and short-term goals as well. Waiting 5 years to have some output to share with community members isn't going to work. You need to have some shorter-term goals as well to show how things are moving along and to provide that information. Understanding the power dynamics between academic partners and community partners, the sharing of resources. In the past, a lot of times, actually most of the time, funding went just to the academics on a project and didn't funnel down to the communities that were doing a lot of the work for these partnerships. So making sure that funding is distributed equitably. And also definitely having respect from the scientific community can be a challenge with doing community engaged work. I think that this has been improving over time, that this research is not biased in any way because it includes community members. It's not of lesser quality. You can have it be very robust. And also that community members have different types of knowledge which are really important in the scientific process. So that brings us to a conclusion. Just want to acknowledge the multitude of funders that have funded all of these research. And just a little cartoon to reflect on at the end. So thank you very much. And I'm looking forward to the question and answer.
Awesome. Thank you, Dr. Fuller. Very interesting presentation. I see lots of people clapping. I think at this point, if you can turn on your camera, I think Dr. Fuller has expressed her interest in seeing faces, and I agree. I would love to see your faces. Thank you. That's awesome. I understand that some people do have internet issues and have to keep their camera off, so don't feel like we're going to call on you if your camera's not on. But it's really great to see everyone. So I just saw one little comment in the chat that Kevin had about that first slide that you had,
yeah,
I had never seen before. I thought it was funny.
I was just
go ahead.
Oh, I was just joking that I get hangry after 5 hours. So even if I might not die until 5 weeks of not eating, that I do get hangry. So, but that was an awesome talk. I really enjoyed it. And you know what? It's funny because I came from rural Pennsylvania, and nearby we had no air pollution other than, you know, the farm type stuff and pesticides and all those things that we should probably have worried about. But we had power lines nearby that everybody was worried about for cancer and cancer driving things. And then I moved to the city and I'm like, all right, I need to live far away from the power lines, but like, I never really think about pollution. So it's all about perspective, I think. And like, in reality, the air pollution is probably much worse than living a couple 100 yards away from like, you know, the power lines or whatever. But so that wasn't really a question, just a comment, but there's so many things to consider.
Yeah, thank you for that. And even as me studying air pollution, you know, there's an element of choice, and then there are definitely restrictions where we have, because both of my kids, the daycare where they went was right next to a highway in downtown Atlanta, because it was run by the school. They had an excellent program and it was convenient to work. And so, you know, taking, you know, even everything that I know, but I also was able to take the knowledge that I know of, okay, first of all, at that point where the road is, it's depressed, it's below grade, so that reduces the pollution that comes out. And they usually play out outside during the lower exposure periods. But it's, you know, it's a fact of life and something that, you know, it's just multi-sectional, I suppose, in terms of even someone who studies air pollution, you know, may live close to sources for multiple reasons.
If only you could have gotten them to wear N95 masks early, then they would have been prepared for the last few years.
Right, right.
Are there other questions or comments for Dr. Fuller? Anybody would like to, because I don't see anything in the chat and the group is small enough, so.
Yes, just speak up.
So,
I'll jump in.
oh, go ahead. Go ahead, Anna.
I was going. It's great to see you, Dr. Fuller. It's been too long.
Good to see you too.
I wanted to have you talk a minute, if you don't mind, about the institutional incentive structure for doing community engaged research. I think you and I have talked in the past about how to balance the time that you have to spend with the community and just managing and doing all the pieces to get relevant and feasible, you know, relevant research and feasible solutions to community problems, and then at the same time be doing all of the publishing that is required to be allowed to continue doing that work. So I think we've had discussions in the past about balancing those different cultures. Maybe you could talk a little bit about your experience with that.
Yeah. It's a challenge to do community engaged research because still even now, it's not I'm trying to find the right words here. So it is not encouraged in the academic reward system. It's not rewarded at all. I think most people would probably agree. Going out and doing community-based research and taking the time to build those relationships. It's something that is kind of shown as, oh, okay, well, that's your area of research and it may be kind of gravy on top. That's nice, but still the level of publishing is the same. And that's what I'm really measured against. I'm not measured against the community meetings I went to, the education that I provided, you know, to community groups, the sharing of information and exchanges. That's not rewarded in our current academic system. So it makes it very challenging. And with getting grants, there have been a few, actually one or two from NIEHS in terms of, you know, community engaged projects, but there's still, I think there's one opportunity now, but besides for that, there's no opportunity that's included and funded to build the relationships that you need for a strong community engaged research project. So that's still not there. They're getting to it, but it's still not there of that pre-work that has to be done.
Thank you. Erin, did you have a question?
Yeah, it's kind of along those lines, but maybe I think there might be people here thinking, well, how can I take that first step in finding a community or reaching out and working with a community partner? So you've gone down the road a bit, but how did that first interaction start? And what recommendations would you have for people maybe just starting out thinking, I would like to do community engaged research, but how do I find that community partner?
Yeah, that's really good. So I've been interested because I started off as an engineer, and then I did that for a few years and wasn't all that satisfied, and then started working with nonprofits in New York City. And so when I went to graduate school, I had come from working in the nonprofit field and working on environmental justice. So I built up kind of my understanding of how the community side works from actually working as, you know, an employee of one of the community groups, that actually several community groups by the end. So, you know, whatever your research area is, you just start looking around and seeing in your community of what groups are active around environmental issues and what issues. Many groups you know, there's small groups, there's large groups. You can find places to volunteer online. If, you know, with different groups to provide different types of volunteer opportunities. Many times going to public meetings around different issues, it may be at the city government level. Many times there are groups that you can find online of just consortium and partnerships around a specific issue, around, you know, for me, air pollution, around, you know, green infrastructure, around brownfield sites, around transportation issues. You can just kind of start by Googling, see what some of the groups are, and go out to meetings and start meeting people. Also, if there are, in Atlanta, there's something called neighborhood planning units. And those are neighborhood level, like governmental entities within the city of Atlanta that have meetings around all issues in their communities, you know, living there, taxes. It's kind of like a, you know, like a HOA, but for the whole neighborhood. So going to some of those meetings and seeing what issues are popping up for people. That's where, if there's an industry that wants to come in and put a company somewhere, or if there's a new plan to put a new park or some kind of redevelopment, they're going to go to those entities, and you can find out about that and what the community thinks about them. So finding groups and really going to the meetings and meeting people.
Yeah, that's really great advice.
Yeah, long-winded answer, but
Great,
So
great technique.
Yeah, sorry. I have I want to go back to the science, the measurement of ultrafine particles.
yeah.
So I have a lot of experience measuring PM 2.5, and several people on this call do too. And that's been kind of the go-to particle size. And I've been very interested in measuring ultrafine particles, but I haven't known how. And so I'd love to hear, I know that's more than a 1 minute response, but I guess I'm wondering, are there low cost detectors, or because the machinery you showed in the back of that mobile
It's expensive.
look expensive. And so I guess I just wanted to know, I mean, we do have low cost ways of measuring 2.5, but the really tiny particles, I'm not familiar with what is available for like use in the field, and whether you do that with your community, collect data with your community partners.
Yeah, so that's true. So PM 2.5 has been the go-to for many years, and that's great. There's differences in the spatial temporal variation between PM 2.5 and ultrafine particles. They don't vary the same way. We've seen independent outcomes from exposure to ultrafine particles. So it's important to measure those, I think, in conjunction with PM 2.5. So in terms of low-cost sensors, which there are some good ones on the market for PM 2.5 and even down to PM1, which is a size fraction that no one kind of knows what to do with quite yet. But PM10 and PM 2.5 and PM1 and are very low cost, you know, $250 for the purple layer monitor. There are none that are that low cost that I have found to be really good for ultrafine particles. There are some that are some thousands of dollars, maybe between $5,000 and $11,000. But it's important to keep track of the field, because there's an interest in ultrafine particles being measured with low cost instruments, and companies are working to get to those low costs. And there are some pilot instruments that are out there, but none that you can kind of, that I know of, you can kind of go online and buy a low cost sensor for ultrafine particles and set it up to monitor long term. Not to my knowledge yet.
Thank you so much. We did put the link in the chat for anybody who wants to. I just opened the link to the book. It looks really interesting, and it's in there. It's in the chat, but it's close to the top of the chat if you're looking for it. It says book. So thank you. Are there other, we have
Yeah.
like 2 minutes left.
Yeah, I have a quick question.
Yes.
I joined late. I'm sorry. I was on another webinar. Fantastic talk. It's very inspiring for a number of levels. In terms of your, so forgive me if you already talked about this because I joined late, but in terms of your measurements, you measure blood pressure. Did you happen to measure particular cardiovascular factors in kids per chance? Did you do any? Okay.
I have
I don't know
not.
if you
So,
covered that.
so what I talked about in the presentation, those were measurements in adults.
Okay.
I have not done any studies involving kids, although I would like to. Much more challenging to do research in kids. I have done some exposure studies though. And I've been doing one right now, actually looking at exposures to ultrafine particles and others among kids. So not yet. Some other people, for ultrafine particles, not so much has been done in children, but definitely a lot more for PM 2.5. I'm thinking of the Children's Health Study from researchers down in Southern California. We have really good, robust data showing a causal association between air pollution and asthma development. Others are more associational, but there's definitely evidence over many years in kids between PM 2.5 and asthma development.
Okay.
But not the evidence there for ultrafine particles yet.
Okay. Thank you.
So Christina, I know we're out of time, but I want to make sure Jen Michael asked about or said that AthLabs, AETH, it's in the chat, has a few low-cost black carbon monitors relevant for traffic
yes,
emissions.
AthLabs. Yeah, I'm familiar with that. Who put that?
Jen Michael.
Jim,
Am I saying
hi.
that correctly?
Hey, Dr. Fuller.
Yeah. So they have some wonderful instruments. They started off with their first really small instruments that can be used for personal monitoring. And then now they have one that's supposed to be for outdoor use long-term. And so many times I do monitor for black carbon. So black carbon is going to be the solid particles in the air. And they have associations with the same health outcomes as well. So they are also a really good indicator of diesel exhaust with those solid particles. Yeah, he's nodding his head like, yeah. So very good marker for diesel exhaust.
Awesome, man, I've learned a lot. Well, I know we're out of time. I just want to thank you very much, Dr. Fuller, and I hope you'll join me, everyone, in thanking Dr. Fuller for joining us, and come back and visit us in person when this pandemic subsides. So you're not that far away. And I just want to remind everybody to give us feedback by taking the survey. I appreciate it. The link's in your chat. Thanks, everyone.
And thank you. I really enjoyed this opportunity.